Hey, everybody. Senator Bill Cassidy here. I apologize being late. It seems a little bit something to say this, but I was on the call with the White House,
Oh,
and they're making a major announcement on healthcare today, and that's why I was not on the call. I apologize. But I can kind of um, uh, address some of these concerns. Let me first say that the president's announcement today will attempt to make some significant changes as regards healthcare for the benefit of patients, particularly those who have less ability to afford their insurance, to afford healthcare in general, to afford their drugs. So I think it's positive. Without knowing definitely what the president's going to be saying, I have had a tip of the hand as to what that might be. Before the election to demonstrate his commitment to making sure that all Americans have access to health care, to make sure that those with pre-existing conditions have access to health care, as well as the tremendous support that has been given to healthcare providers throughout the COVID crisis. Now, in general, I'll just speak about what's the federal state of play right now, go into some of the things we're working on as regards telehealth and telemedicine, and then some of the priorities that are coming up. First, I think many in this audience probably benefited from the CARES packages that have already gone forth. The CARES packages had a lot of support for providers who, paradoxically, during the COVID crisis, ended up losing a lot of money. Everybody was sick, but nobody was coming to see the doctor unless they had COVID. And that, of course, ended up causing a revenue shortfall for many providers. So there is an attempt, by the way, for some of you who may have taken an advance payment on your Medicare. There has been some concerns on your Medicare fee for service. There have been some concerns as to the ability to get that money paid back. We will have a continuing resolution that passes probably next week in the Senate that addresses this, making the terms of repayment more lenient, stretching them out, lowering the interest rate. So if you are one of those who took that advance payment for fee for service, there will be some relief coming your way. I'd like to tell you there would be another CARES package coming before the election. I don't think that will be the case, partly because filling the Supreme Court seat is now going to take all the energy of the Congress, all the attention of the press, but also politics are up and we're close to the election. So I think if there is a next CARES package, which I personally advocate for, it'll occur after the election. In that case, those healthcare providers that continue to have a lingering negative effect of the economic shutdown, hopefully there'll be some relief there. Some folks in this room may have taken the payroll protection plan and or been affected by the supplemental payments for unemployment insurance. In the case of the latter, I know some healthcare providers that were unable to hire people because the $600 supplemental payment meant that folks were making more money on unemployment than they were working. I've heard from more than one healthcare provider regarding this. So first, as regards the PPP, there would be some attempt to address repayment status for those who took less than $150,000 from the initial payroll protection plan, perhaps even loan forgiveness, but certainly a kind of continuing to build upon the efforts to make it easier to repay, more understandable how to do so. Secondly, there could be a second payroll protection plan. There's been some industry that's been terribly hit. I think restaurants, for example, they're the best example. K. Paul's in New Orleans has closed its doors forever, an iconic restaurant. But there'll be other entities as well. One criteria that has been floated is that if the amount of money you received from a year ago to now has decreased by as much as 25%, then you would be possibly benefiting from the next payroll protection plan. Let me just briefly conclude, knowing that you have to stay on schedule. Telehealth, a lot of positive things were done with telehealth and telemental health. If you will, that may be a silver lining in the COVID crisis, putting more money and flexibility, which sped expansion. And so I do think those rules will be made permanent. I'm advocating for that as well. There's also going to be a big push by the administration to improve access for rural communities where clinics and hospitals might be far away. Last, end of year priorities. What can we do about surprise medical billing? I've already spoken about the president's initiative to lower healthcare costs, but there's pending legislation in Congress too. And then working on healthcare disparities. Maternal mortality, for example, women of color having higher mortality rates than others, particularly affecting us in Louisiana. What can we do about that? And then continued initiatives for chronic disease. COVID has clearly hit those with chronic diseases more than it has affected others. What can we do to address this? Well, I know you've got a program, and frankly, I'm supposed to be on another call already. I apologize for being on late. I thank you for all your good work. If there's anything we can do to serve you, please let us know. Thank you.
And I just want to point out, for those of you that may not know Senator Cassidy's background, he's dedicated his life, his professional life, to helping those in need. He's a graduate of LSU Medical School. He taught at the Earl K. Long Hospital, which was a hospital for the uninsured, and he co-founded the Greater Baton Rouge Community Clinic, which provided free dental and health care to the working uninsured. So he has really dedicated his life to helping us, and I'm glad we were able to make that call happen. And so now we're going to take a break until about 9:45, if that's still the schedule, Holly. We'll take a break for a few minutes if you want to walk around, and we'll start our second panel around that time. So.